Hi, everyone. My name is Jen Bolster, Paramedic Practice Leader with the Department of Clinical Governance and Professional Practice, here today to provide an update on decriminalization of personal drug possession in British Columbia and how it influences paramedic practice. So, as you may already be aware, as of January 31st, adults in British Columbia will not be subject to criminal charges for the personal possession of small amounts of certain illicit drugs. Health Canada has granted this exemption from the Controlled Drugs and Substances Act to the province of British Columbia until January 31st, 2026. Decriminalization of people who possess illegal drugs for personal use is a critical step in British Columbia's fight against the toxic drug crisis. Will really help reduce the barriers and stigma that prevent people from accessing life-saving services, including emergency health services in the 911 system. It's important to note that substance use is a public health matter and not a criminal justice issue. The British Columbia specific exemption will be in effect for 3 years while evaluation of its effects and impacts are studied. Personal possession of up to a cumulative amount of 2.5 grams of opioids, MDMA, cocaine, and methamphetamine will be included in the exemption for adults over the age of 18. During this period, no arrests or charges will be brought against people who are found to be in possession of less than that 2.5 grams of personal possession of these substances for their own use. It's important to recognize that BC Emergency Health Services supports decriminalization as a means to help lessen the stigma associated with drug use. It's also important to note that British Columbia is the first province in Canada to decriminalize small personal amounts of illicit drugs and signals a major shift in how substance use and addiction is viewed. So, how does this impact paramedic practice? Well, in short, a patient's personal possession of substances or illicit drugs should be treated like any other patient property. If a patient can manage their own possessions, they should continue to do so. Paramedics are not required to determine whether the patient has drugs on their person or in their belongings. If a patient cannot manage their own belongings, paramedics should take all reasonable steps to safeguard an individual's possessions and turn them over to hospital staff to secure following standard documentation processes. As a reminder, patient belongings should not be searched by paramedics, nor are paramedics expected to be searching a patient's belongings for substances. Should a paramedic encounter a situation of an incapable patient where they become aware of the presence of drugs of this small quantity and type, and there is no other appropriate authority on scene to manage the drugs, with gloved hands, paramedics should take the substance, place it in a red biohazard bag for handoff to the hospital with the rest of the patient belongings to be labeled and secured by hospital staff. We're asking paramedics that during handover that this is a witnessed process and that you're documenting the handover and the patient belongings, including the illicit substances, in the patient belongings section of the electronic patient care record. For public safety reasons, illicit drugs should really not knowingly be left unattended at scene or left behind. You may be wondering what 2.5 grams of an included substance looks like. Well, you can see on the screen here an approximation of 2.5 grams. What's really important here is that we're not asking paramedics to be weighing or determining definitively how much of a substance there is or if it is under that 2.5 gram limit. This is simply an approximation for your awareness, and you are not expected to be able to determine in the moment if it's under that 2.5 gram amount. You may also be wondering if it is hazardous to be touching a patient's illicit substances. And so I think it's really important that I address some common myths and facts that are evidence-based and supported by WorkSafe BC, the BC Centre for Disease Control, Health Canada, and others. So the first myth is that touching even a small amount of fentanyl can cause an opioid overdose, coma, or death. The fact is that incidental skin exposure to fentanyl is extremely unlikely to immediately harm you. Despite the phenomenon of first responder opioid exposure that seem to be frequently reported in the news media, this has not been confirmed scientifically, and in fact, the consensus of the scientific literature remains that illness from unintentional exposures is extremely unlikely. That's because opioids are not efficiently absorbed through the skin and are very unlikely to be carried in the air. The second myth is that PPE cannot protect you from fentanyl exposure. The fact is that when worn correctly, PPE will protect you. So do wear task-appropriate PPE. In this case, you're going to be wearing nitrile gloves, properly fitted respiratory equipment if there is concern that the substance may become airborne, and safety glasses. The third concern is that standard precautions for dealing with suspicious substances do not apply to fentanyl specifically. The fact is that occupational health and safety precautions on contact with unknown powdered substances are appropriate for most incidental encounters with fentanyl. So do wear your appropriate PPE identified as required for the specific task or activity, in this case, potentially handling or caring for a patient who may have been in contact with illicit substances. Wash your hands with soap and water often and after handling suspicious substances or patient care, and use proper decontamination and notification procedures for contaminated equipment or clothing. As a reminder, do not eat, smoke, or drink after handling an unknown substance until you've washed your hands. So I'm just going to conclude by summarizing some best practice handling guidelines if you are to be handling a patient's personal possession of substances, followed by some resources and academic references. Number 1, wear PPE, including nitrile gloves, a fit-tested N95 mask if airborne contamination is suspected, and safety glasses. Number 2, ensure to wash your hands following any handling, and ensure to not smoke, eat, drink, or touch your eyes prior to washing your hands. And third and lastly, do not open, taste, or smell a substance in an attempt to try to identify the substance. As a reminder, paramedic safety and care of our patients remains our absolute top priority. I hope this short video will help address some of the questions you may have related to this exemption. But if it hasn't and you still do have some questions or comments or concerns related to this exemption, please do email us at clinicalpractice@bcehs.ca, or feel free to drop your questions in the comment section below and we'll address them as soon as we can. Thank you very much and bye for now.